Antonio here, enhanced movements, but we're going to be talking about pressing. Okay, so last week the post was about shoulder positioning, shoulder mechanics, centrating the joint, so keeping that shoulder joint in the middle, and that's where it's going to best function, and how push-ups, burpees, and things like that may alter that position and potentially cause pain. Okay, so before I kind of did a very short demo of doing this incline push-up where my shoulders were shrugging up. So we're gonna start with that because that's the foundation for a burpee. A burpee is really just like a metabolic dynamic push-up, right? Chest touches the ground, then we pop up, okay? Now, the example I use with a lot of patients, I ask them if they have siblings or if they've ever played a sport, contact type of sport where there's pushing. And the question is, if you were to go up and push someone, how would you push them? Very rarely will anybody come up and do this, right? Shoulders shrugged and hands high. That's not a powerful position, right? If you're an offensive lineman, you're gonna come up underneath here and grab because that's where you have force, right? If you're gonna push someone, we kind of come into this position here. And the reason why we talk about this is the position of the shoulders in terms of leveraging force, right? If I shrug and I'm up like this, right, we kind of demoed this before, that shoulder's coming up and forward, a lot of anterior load going into that shoulder as I'm trying to push away, right? If I'm here, as I'm starting to press, that shoulder then kind of has to sit back and forth, so we're getting a lot of this movement going across that joint surface while we're generating load and force, right, which can be detrimental. Now, some of the corrective exercises we talk about, right? Lower sternum is the kind of aim or target that we're trying to get to whatever surface we're doing a push-up on. So if you're doing a push-up, it's going to be a little different for females versus males, but the target area is going to be thumbs in between, the sternum going in between the thumbs. So although a different part of your chest might be either touching the surface area of the incline push-up, the box, or the ground, what we're going for is lower sternum between the thumbs. So in this case, it's super easy to see, right? Because that barbell is only so thick, my hands are right on there. So now I'm gonna simply lower myself, lower sternum to that target. Most times when it's the first time someone's doing this, they really feel like they're leaning forward on their hands, which is good. That's what we want. I'd rather you be there than in this position where the bar is coming up at my upper sternum, forcing me to shrug to keep my body on top of it. If I don't shrug in this scenario, you can still do it, right? But it's gonna be a much more extensive kind of like tricep push-up from here. Like think of that old school, like kind of skull crusher motion. Way harder in the triceps. Push-up is pecs and triceps, right? We're distributing the load between both. So give that a try. Okay, so the same thing goes. I'm gonna move this down here real quick. Right, so push-up, if I'm doing push-up here, there's that line, right? If we draw a line right here between my thumbs, I'm going lower sternum. That's what's gonna be touching there. I'm not gonna be, if I'm coming higher, I'm gonna be dipped in like this. I wanna keep a big broad chest, shoulders pulled back, and then I'm gonna press from there. Okay, so one more time. So, the other, that's what we're gonna start with today, okay? The next one we're gonna talk about is other small cues that's gonna help assist with what we're trying to achieve here, okay? That's gonna be starting ground, just tinker around with that. And then the next post will be about some additional cues that will help, okay? Stay tuned.